Alzheimer's disease is one type of dementia, which is the most common type of dementia. In Alzheimer, the person begins to experience a loss of reasoning, thinking, and remembering to the point where there is a definite dysfunction in patients' daily life and activities because of these losses. And there are the other type of dementia other than the Alzheimer. Alzheimer being the most common one, but the other types are frontotemporal disorder and the Lewy body dementia. Generally, the memory impairment signals the early onset of Alzheimer. But in other cases, you can see the patients who are having trouble finding the words, the vision, the spatial differences, and the impairment in their reasoning and judgment skills. There's one condition called as mild cognitive impairment, MCI. Sometimes that can signal the early Alzheimer. But all the people who have MCI do not go on to developing the Alzheimer disease. Yes, there are different stages of Alzheimer's disease. There's a preclinical stage when you don't see any symptoms, but the brain changes begin to occur, but you don't see any overt manifestation of the illness. In the early stage, you can see like we talked about, the memory loss, the trouble finding the word, the reasoning and judgment skills. And then when it progresses to the next level, moderate level, you can see more memory loss and the confusion. The patient begins to get more confused and disorganized. And when it progresses to the later stage, then that's where the real problem starts, where the patient will have real trouble taking care of their basic needs. Sometimes they can even go on to trouble swallowing, loss of weight, sleeping too much, and ultimately end up needing total care. We really don't fully understand the causes of the Alzheimer's disease. Generally, when you see Alzheimer in the early age, in 20s and 30s, it has a strong genetic component to it. But in the later stage, in 60s and 70s, when you see this illness, there's generally an interplay of genetic components, environmental and lifestyle factors. Yes, but only in the early onset Alzheimer you will see the component of genetic mutation and familial tendency. The more classical type of Alzheimer, it's not hereditary. Some people have made claims that there is cure, but there's no clinical evidence that we have found any cure for the Alzheimer's disease. Some medications have been used to slow down the process of Alzheimer's disease or treat some of the behavioral components of Alzheimer's disease and dementia, but unfortunately there's no cure. There's no clinical evidence that we can do anything to totally prevent the Alzheimer's disease. Of course, some of the lifestyle changes, the proper exercise, diet, and maintaining the proper weight can go a long way to prevent some of the chronic illnesses that go along with the Alzheimer's disease. And there have been interest in certain things like improved intellectual stimulation, expanded social functioning, that can have some role in slowing down the process of Alzheimer's disease.